Well, hello, it's Bruce Williams again, and today I want to present part 2 of my series on the selected gross pathology of the horse, which we are going to talk about the hematopoietic system. As I do at the beginning of all my lectures, I want to thank my friends and colleagues over the years who have provided such fantastic images which allow me to put these lectures together. Let's start with an incidental finding in horses that have splenomegaly for any number of reasons. It could be simple congestion, it could be a number of other conditions such as parasitism or inflammation that causes marked splenomegaly. And unlike the cow, which has a very thick splenic capsule, the splenic capsule of the horse is not quite as thick. And when you jam too many red blood cells in the spleen, some of them are going to pop through the capsular surface. You can even see how thin this capsule is. And you get these little blobs of splenic red pulp on the outside of a spleen. Not a big deal, just tells you that that spleen is larger than it should be. Here's a striking picture to start our discussion of autoimmune hemolytic anemia in the foal with. And this is a cross-section of the trachea. We've all seen a lot of tracheas, and we know that they should not be a bright yellow-orange. So this animal is hugely icteric. Autoimmune hemolytic anemia is a devastating disease which manifests in the first 5 days of the foal's life, when the foal unfortunately receives antibodies in the mare's colostrum to antigens on the red cells. It all starts when the sire has antigens on its red blood cells that the mare doesn't have. And then after conception, those antigens will be present on the surface of the foal's red blood cells. The mothers are normally immunized naturally by small focal placental hemorrhages where the foal's red blood cells enter the maternal circulation, and she can make antibodies against those foreign antigens on the cells. Repeated breedings with the same sire increases the chance of this disease. Rarely you can see this in association with vaccines, especially vaccines that were created from aborted foals by equine herpes virus. They used to be used locally, and it was a great source for foreign red blood cell antigens. So the foals get antibodies to their own cells and colostrum. The amount decreases over time, luckily. And if clinical signs are going to be seen, they can be seen, usually seen within the first 5 days of life, but they can be seen as early as 8 hours. And the first thing that you're going to see is that the animal is going to start to turn yellow. You'll see icterus in multiple organs. You can see hemoglobinuric nephrosis or pigmentary nephrosis in the kidneys. They'll turn a dark blue-black color. And this is the spleen from one of these foals. It is very enlarged. You can see that it has a yellowish cast to it, and there are multiple infarcts in the spleen. Whenever the spleen in any species gets very large, you put too many cells in there, because of the tenuous nature of the circulation of the spleen, as cells tend to sort of percolate through it like an old percolating coffee maker, you tend, when you get too many cells in there, to really compromise that blood vessel or the vasculature, and the spleen infarcts more than any other organ. And it all simply goes back to having just too many cells in the spleen. You get a lot of macrophages in here which will be gobbling up all of the erythrocytes in these particular cases. If you incise this spleen, it's not going to ooze blood on standing. It's going to histologically appear like there's no EMH. And you may also, in these animals, you need to look for signs that are associated with treatment. Usually these animals are, in attempts to save them, they're withdrawn from colostrum, so later on down the line you may have a variety of infectious disease. The other thing that you do is that you pump them full of steroids to try to decrease the body from gobbling up those cells, and this is going to also predispose them to infectious disease. You'll also see, because of the release of iron from the hemolyzed cells, you're going to see a lot of iron in multiple organs, including the spleen and the liver. And toxic levels of iron may be seen in some of these animals. On a examination of a blood smear, you're going to see a severe normochromic anemia with macrocytes, which are very large red blood cells, and circulating immature forms, which are released from the bone marrow to try to alleviate some of the hypoxia that you see in these animals. So that's autoimmune hemolytic anemia, the exposure of the mare to the sire's foreign erythrocyte antigen. Another very important disease in the hematopoietic system of the horse that everyone who's owned horses knows about is equine lentivirus infection, or equine infectious anemia. We're looking at a cross-section of the spleen, and you can see the spleen is extremely hypercellular for a number of reasons. It is very enlarged, and the white pulp is extremely prominent. This is a very acute case. Lentivirus is the first thing that they're going to do in the body, because they infect lymphocytes, is cause a hyperplasia of the white pulp. And then over time, like all lentiviruses do, you're going to have necrosis of lymphoid elements, and then ultimately this spleen is going to be relatively thin. It will have some large but very hypocellular follicles, which look like bullseyes. In between, you are going to see a tremendous amount of EMH as these animals go through a cyclic, lifelong viremia. The first couple of bouts of equine infectious anemia are the worst. If the animal survives the first 3 or 4 cycles, then generally it will become a lifelong character. Some infections are acutely fatal. Some infections are subclinical to asymptomatic, and it's very difficult to predict the course in any particular animal. One of the things that you will generally see in animals with equine infectious anemia is you will see bone marrow hyperplasia in adult animals to replace the loss of erythrocytes, and you'll see very red bone marrow in adults. It's interesting the way the bone marrow becomes hyperplastic in horses. It tends to go from one side of the bone marrow to the other. So in some of these cases, if you're lucky, you're going to see that particular progression. The histologic picture also changes significantly from the acute phase, in which you will see extensive necrosis of lymphoid elements, and because of the profound lysis of blood cells, you may see ischemic necrosis in a number of organs. Over time, in the more chronic stages, you'll see other signs of viral infection. If the animal lives that long, you'll see periportal lymphocytic infiltrates. You'll see reticuloendothelial hyperplasia of the spleen with a lot of iron in the spleen. The follicles in the spleen, as we talked about, become somewhat hollowed out like bullseyes. And because it is a chronic viremia, you can expect to see immune complex glomerulonephritis in the kidneys. So an important and interesting insect-transmitted disease of horses, equine infectious anemia. Another disease which is not as important, is a little bit more of a historical disease, because the breeders of Arabians have pretty much taken care of it in the bloodlines, is a condition that has traditionally been seen in Arab foals that are severely immunosuppressed, and these are called skid foals, or severe combined immunodeficiency, foals. It's seen in about 2%, or used to be seen in about 2% of Arab foals due to defects in the expression of a particular gene product known as DNA-dependent protein kinase. This product connects the VJ and D gene segments, which go together to form B and T cell antigen receptors. The condition can affect just T or both B and T lymphocytes, resulting in a loss of both cell-mediated and humoral immunities, and leaving the animals with this autosomal recessive condition open to a tremendous number of infectious disease, which often claim them shortly after birth. This is a section of the spleen of one of these animals, and what you'll see is tremendous hypoplasia of the lymphoid organs, because they can't make B or T cells, and so the lymphoid organs, including the spleen, the thymus, and the lymph nodes, and to a smaller extent the bone marrow, are all hypoplastic. Remember, we talked about how thin the capsule is in the horse, and this one looks very thick, and it's not because the capsule's any thicker, it's because there's just not much in the spleen. Remember, this is a young animal who is experiencing a lot of antigens for the first time, and they should have a pretty good response and a lot of white pulp hyperplasia, and you just don't see that in these particular animals. Just to give you another example of how small this spleen is, let's look at some other spleens we've already looked at with similar markers on the picture. Okay, these are a little bit hyperplastic, but you can see how the spleens match up against this particular spleen. So tremendous splenic lymphoid hypoplasia. These animals are profoundly lymphopenic too. Neutrophils will compensate in the blood initially because that's pretty much all they have to fight off the infectious agents that are normally taken care of by cell-mediated immunity. These are animals that you are going to see infections with Pneumocystis carinii. You have to have functioning cell-mediated immunity to combat that particular fungus that is ubiquitous in the lung of every animal. And if you don't have any cell-mediated immunity, it's going to take over. So that's a very common infection in these animals. Something else that you might see are other diseases that are usually combated by cell-mediated immunity. Cytomegalovirus and adenovirus infections are classic infections in the lung. These animals usually die within a matter of weeks, often with a pneumonia and a raging case of enteritis due to a number of other agents that the body normally takes care of without any trouble. So severe combined immunodeficiency of Arab foals. We don't see it very much anymore. It's a little bit of a historical disease. You can also see similar diseases in Jack Russell Terriers, strain 17 mice, and humans as well. So it's best known in Arab foals, but certainly not exclusive to them. Here's a fantastic picture looking at starting to look at lymph nodes a little bit here, and a great picture by my friend Dr. Ingeborg Langor, who's a professor down at Louisiana State University. Just absolutely brilliant. Love her to death. Speaks 4 languages. I can barely manage one. And I'm always impressed with brilliant people. But this is a wonderful picture of, this is a lymph node. It's massively enlarged, and this is a disease we're going to talk about a lot more when we get into other organ systems, but here is a hemorrhagic lymph node. It's been incised and is leaking this creamy whitish yellow pus. And this is a condition that is known as bastard strangles. Strangles is caused by Streptococcus equi. This is a host-adapted form of Streptococcus, which causes a number of problems in horses. Streptococcus equi variant equi is a causative agent of a disease known as strangles. It affects the lymph nodes. It is often carried in the respiratory system, and it has receptors which seem to hone in on the lymph nodes of the submandibular area, the cervical lymph nodes, and it generally, when it manifests, it will cause, following a short upper respiratory infection, will cause abscessation of those lymph nodes. And most animals, along with their veterinarians, are able to compensate for that, but in about 20% of cases, that strep equi is going to go elsewhere in the body. It can go to lymph nodes all over the body, which it's done here. It can go into the guttural pouches, which are in the area. It can actually get into the meninges, cause meningitis. And we have already talked about a long-term sequela to animals, or for animals who have been infected by strep equi, purpura hemorrhagica, where it causes a type 3 hypersensitivity and small petechia all over the body on the surface of the mucosal membranes, in the organs, etc. So just a wonderful picture of a ruptured mesenteric lymph node in an animal with bastard strangles. Here's an absolutely fantastic picture of a lymph node that is studded with small granulomas. You can see there's no definitive cortex or medulla. What we have are these little coalescent granulomas. The medullary sinuses are absolutely filled with macrophages. And while horses can get granulomas, just like most other species, from a wide range of conditions, including dimorphic fungi, certain types of bacteria like Mycobacterium. This is a wonderful picture of a mesenteric lymph node from an animal, from a horse, with a condition which has been a mystery for many, many years, known as granulomatous enteritis. We're going to talk about it when we get to the GI tract, but it's such a good picture of one of the lymph nodes and what a good granulomatous lymphadenitis would look like. So, granulomatous enteritis is a disease of horses, which can be of any age, sex, or breed, but young standard breds, generally between the ages of 1 to 5, appear to be the most commonly infected. The cause has never really been isolated, although my good friend Fabio Del Piero said that during his time in New Bolton, where they saw a lot of these animals, mycobacteria were isolated in about 50% of cases. The lymph node lesions really don't cause the problem. The problem is the infiltration of the wall of the intestine with tremendous numbers of epithelial macrophages and lymphocytes and plasma cells, giving an appearance and a altered function that is reminiscent of Johne's disease in cattle, or Crohn's disease, a form of inflammatory bowel disease, in people. You can also see granulomas in a couple of other organs. You may see them in the liver, you may see them in the lung as well. It likely represents an abnormal host inflammatory response to intestinal bacteria or dietary components, which may be very normal for most individuals, and then certain animals will hyperreact to these particular dietary components. Other theories have been exposure to aluminum in affected animals will cause this, but that doesn't seem like it would be a cause of the number of cases that have been seen over the years. The incidence, and you can still see it, but the incidence of this particular disease, or maybe just the sensitization to it, has decreased over the years. I won't say it's a historical condition, but we simply don't see the number of cases that we used to in the 90s, for example. Okay, well, whenever we get to any species and we're in the hematolymphatic system, we're always going to end up talking about lymphoma, and it should be no surprise, as it is in most other species, that lymphoma is the most common malignant neoplasm of the horse. Across the spectrum, most of these particular lymphomas are diffuse, large B-cell lymphomas. Histologically, when you're trying to prove them, the neoplastic cells generally stain better with CD20 than they do with CD79A or other B-cell markers. Now, before we characterized lymphomas by their immunophenotype, we used to characterize them in sort of a systemic fashion by the syndromes that, or the organs that were affected. And horses have 5 or 6 different syndromes of lymphoma, which are sort of still good to remember. In earlier editions of Jubb and Kennedy, these were stressed a little more. The latest edition tends to stress the immunophenotyping a little more, tends to lump them together, but I still, because you will sort of classify them in your head a particular way, even though most of them are B cells or T-cell rich B-cell lymphomas. There's essentially 6 different forms of lymphoma. We're going to mention a couple of them, and 1 or 2 are pretty uncommon. We're going to see them again when we get to the GI tract and when we get to the skin. The most common form is a multicentric form, which affects organs both in the abdominal and the thoracic cavities, and you can also see it in the skin, generally in the trunk, as multiple non-ulcerative nodules. And I don't want to confuse this with subcutaneous form, which we'll talk about in a minute. These are B-cell tumors, and showing you this particular slide is a little misleading because in most cases of lymphoma, including the multicentric form, peripheral lymphadenopathy is not a big component. They tend to be visceral nodules. In the dog, you often see a lot of lymph nodes, but not so much in the horse. But you know, it's a really nice picture. So, and you can occasionally see them. So the multicentric form is multiple organ nodules. You can also see it in the GI tract, and there are 2 different forms of GI lymphoma in the horse. You don't want to confuse, so multicentric is a big one. I mentioned, and we're going to talk about in a later lecture, of subcutaneous lymphoma in horses, and it's gone by a number of names. It's a T-cell rich B-cell lymphoma that is primarily seen in thoroughbreds. It's often seen in females. It's a very interesting particular tumor. This is a particular tumor that will regress during pregnancy because it has the neoplastic cells appear to have progesterone receptors on them, so it will flare during a progesterone. If the animal has a granulosa cell tumor, which is secreting progesterone, or a luteinized cyst, and then if you take that tumor away or remove that ovary, it will tend to wane a bit. So they are hormone responsive, T-cell rich B-cell tumors, not ulcerated, and could be hundreds of nodules in the skin of female thoroughbreds. Just another picture in the spleen. This is a once again multicentric, so you'll see nodules in any range of organs, including the pancreas or the thymus or various places in the GI tract, mesenteric lymph nodes, just about anything. You may find these particular nodules of the multicentric form. I did mention that there were two lymphoid versions in horses. The first one, and they're a little confusing because they used to be called the alimentary and the abdominal, and I never could keep it straight, but the alimentary is the one that affects the upper intestine, the pancreas, and the regional nodes. So it's the one that you will see in the duodenum, maybe the upper jejunum. It's a cool one because when you get a biopsy, the cells are uniformly plasmacytoid. So it looks like a bunch of plasma cells. These animals are often anemic. They are hypoproteinemic. They even may develop toxemias due to the extensive infiltration of the submucosa and the muscularis mucosa. They are not associated with the mucosa, as opposed to the other form, which used to be called the abdominal form. It tends to involve the colon and the caudal abdominal nodes, as you see here. But now it's referred to as enterocyte-associated T-cell lymphoma type 2. They tend to are B cells with a high mitotic rate. They may resemble large granular lymphocytes, and these involve the colon. There's usually widespread masses in the colonic lymph nodes as well. So you have the alimentary form, which affects the upper system. It looks very plasmacytoid. And the lower system, the EATL type 2 lymphoma, used to be called the abdominal form. This form of lymphoma is also commonly seen in standard breds as well. Well, I think we've had enough lymphoma. Let's go to one more neoplasm, which you can see in the hematopoietic organs, especially lymph nodes and spleen. We're looking at a huge spleen here in a old gray horse. Maybe it's a Lipizzaner horse. And melanomas are something that we will cover later on when we get to the skin. But important to know one particular concept, and that is the difference between gray horses and how they handle melanomas versus brown horses. Gray horses, which have a graying gene, also allows them to handle a much heavier burden of melanomas before succumbing to clinical disease. It's very common to see melanomas in gray horses. They often will start in and around the tail head. They will migrate up either side of the caudal vertebra. They may move forward into the abdominal cavity, but these old horses, you'll be amazed at how many tumors they'll have. Whereas the brown horses, a couple of tumors and they're gone. So it's a great concept. We know a lot about classifying and in the skin. We have great classification systems for dogs, and we count mitotic figures, and we say this is malignant, this is benign. In horses, we don't have that kind of system. They're all, at least in our shop here, they're all melanomas. And it's more of a what color is this horse versus, hey, we're going to count mitotic figures. So an important concept, and betting with the size of this spleen and the number of melanomas within, I would imagine this was a gray horse, and it was absolutely loaded in other organs as well. Okay, finally, I'm going to finish just with one toxin, which will cause tremendous methemoglobinemia and Heinz body anemia in adult horses, and this is red maple. When the horses at the end of the season, they don't have access to a lot of good feed and they're bored, so they will ingest these red maple leaves. And because of the horse's decreased capacity to reduce methemoglobin, their methemoglobin reductase enzymes work very slowly. They will develop a Heinz body anemia from the gallic acid that is ingested in these red maple leaves. There are a couple of other compounds, and their names are way too long for me to pronounce, which may work in concert with gallic acid, but that's the one that you want to remember. Leaves from other maple trees, other species of Acer, may cause disease, but is generally not as potent and will not result in methemoglobinuria to the point that the red maple will. And what we're looking at here is we're looking at a very dark cortex, because the blood is a very dark brown color. When we see a cortex of the kidney that's this dark, one of the things that you want to think about always is hemoglobinuric nephrosis, but what you would generally see in that case is the renal pelvis will be yellow-orange because of icterus. We're not seeing here, we're just seeing this reddish coloration. The damage to the kidney is not due to the methemoglobin itself. It is a non-toxic thing, but it's due to the ischemia. And you'll see ischemic damage in a number of organs in these animals because methemoglobin is unable to carry oxygen. So these animals may die peracutely, especially if exposed in late fall to a lot of these leaves. If they don't die acutely, you'll see significant weakness and depression. You may see icterus, you'll see enlarged spleens, and a blood sample will be discolored, a very dark brownish color, and can be tested for the presence of methemoglobin differential, or a blood smear will show Heinz bodies within the cells. The tissues of the body will also may be icteric, or may have, in more acute stages, may sort of have this muddy brown color, and the mucous membranes often are cyanotic. So this is red maple toxicity in the horse. Okay, well, that is the end of today's lecture. About 30 minutes. Tomorrow's lecture is going to be significantly shorter. We're going to talk about, every once in a while I like to give a short lecture, we're going to talk about the endocrine system of the horse. And really there aren't a whole lot of diseases, and most of what we're going to talk about occurs in the pituitary gland, but that's something to look forward to tomorrow, a short lecture from Dr. Williams. Okay, well, thanks so much for tuning in. For the last 2 days I've had my kitty cat here in the office with me, giving me whispering things in my ear when I screw things up. Miss Smeagol's here today, and Smeags, thank you for keeping me straight on these lectures. I wish all of you out there a wonderful day. I hope you're enjoying great health, and we'll see you next time.